starting.
Okay, so we're gonna start with the cribriform plate, and that is where olfactory, that's where the olfactory cranial nerve 1 is gonna go through, olfactory, through the cribriform plate. Then we have the optic canals, and this is where cranial nerve 2 is going to go through, which is ophthalmic, optic. Then this big hole right here is our superior orbital fissure, and in these orbital fissures, cranial nerves 3, 4, 6, and V1 are going to pass through. Then we have our inferior orbital fissure, and this is where V2 is going to go through. Flip it over again. We have our foramen rotundum. 66 is our foramen rotundum, and V2 is going to go through there. Then we have our foramen ovale, and that is where V3 is going to go through. And then we have our foramen spinosum, and that is where the middle meningeal artery is going to go through. Then we have our internal acoustic meatus, and through that is going to be our facial nerves, so 7 and 8. Then we have our jugular foramen, and through that we have 9, 10, and 11. Then we have our foramen magnum, and that's where the spinal cord as well as the vertebral artery and cranial nerve 9. Then we have our hypoglossal canal, and that is cranial nerve 7 is going to run through there. Then we have our supraorbital foramen, and that's where V1 is going to go through. Our infraorbital foramen, and that's cranial nerve V2. And then we have our incisive fossa, that's cranial nerve V2. We have our carotid canal, which is right here on both sides, carotid canal. And that is where the internal carotid artery is going to pass through. On the back here, we have our stylomastoid foramen. Stylomastoid foramen, and through here is cranial nerve number 7 is going to pass. We have our greater palatine foramen, which V2 is going to pass through. We have our lesser palatine foramen, which is also V2. We have our mental foramen, which V3 is going to pass through. And last but not least, we have our mandibular foramen. And in this, V3 is going to pass. That's it.